Well, a warm welcome to today's talk, Wednesday the 5th of April. Now, I'm going to be looking at the Australian government banning Oxford AstraZeneca vaccine in a moment, but I was actually down in Oxford doing some work locally a few weeks ago, and they have this in the, let's just say the museum of one of the universities there. And this is the model of the adenovirus vector vaccine based on the chimpanzee adenovirus. And we see the spikes of the chimpanzee adenovirus. This tells us it's a single nanoparticle of the Oxford AstraZeneca vaccine. Celebrates the remarkable story of Oxford University researchers who developed, there we go. You can actually see the DNA strand inside the viral particle there, as it transports the RNA into a cell, into the nucleus of your body cells, where it produces the RNA, which produces the protein. Quite a beautiful model, really. I'm a little surprised they haven't chucked a blanket over it by now, but it was still there 3 weeks ago, so presumably it's still there now. Let's just look what's happened in Australia. They're clearly saying now there's a link between the Oxford AstraZeneca vaccine and a rare but serious side effect, thrombosis with thrombocytopenia syndrome, TTS. AstraZeneca vaccine no longer available as of the 20th of March. And the reason is so there will be no further cases of AstraZeneca-related thrombocytopenia. So they're clearly saying that one is related to the other. They are stopping giving the vaccine so that there will be no further cases of these adverse events. And we've got lots of data from the UK that confirms this as well. So this is the table about the number of UK spontaneously suspected adverse events from the UK yellow card scheme. So this is the number of doses given, and this is the number of side effects here. Let's just look at that in a bit of a blow up there. And we can see there's a clear correlation, can't we, between the number of vaccine doses given, and we see that the number of side effects, the number of adverse reactions clearly mirror that. And thankfully, we stopped giving as much of this vaccine in autumn 2021 in the UK. But it's not just the thrombocytopenic thrombosis syndrome. Here's a load of other adverse reactions caused by this vaccine from the yellow card scheme: blood and lymphatic disorders, cardiac disorders, gastrointestinal disorders, general disorders, infections and infestations, musculoskeletal and connective tissue, nervous system damage. So many of you have written to me and talked to me with heartbreaking stories of nervous system damage after this vaccine. And the list just basically goes on. We could put a lot of numbers on this if we wanted to, but there we see the risks associated with the Oxford AstraZeneca vaccine. Here's more detail on that. It gives all the numbers there. I'm posting the link to this, of course. Peruse it at your leisure. But this column here shows a particularly unwanted form of side effect. The particular side effect that we really don't want to occur, but is occurring according to the yellow card data. So even psychiatric disorders there, which really, if it's affecting the nervous system, isn't too surprising, really. So look at that for yourself. This is the particularly unfortunate side effect that was in the right-hand column. So that's an unfortunate side effect of the vaccine. We don't really like to see this particular outcome, and yet it is clearly there in the data. And this is the UK at the moment. We're advising vaccines, not the adenovirus vectors, of course, for the over 75s only, and those with severe risk. Do you get the impression that we're kind of peeling back on the vaccine programme somewhat in the UK on the quiet? Why am I saying that? Well, the reason I'm saying that is the Australian authorities were quite honest about why they've redacted or taken out this vaccine, why they've stopped giving it. In the UK, we've got the British Heart Foundation, which is kind of semi-official, saying the evidence shows that the mRNA vaccines, Pfizer and Moderna, are more effective at a booster protection than COVID-19. So these are what's going to be offered. So we've got the British Heart Foundation saying they're fine, well, they're not saying anything, but they're just saying, well, these other ones are better, so we're using those. At least the Australian authorities have got the decency to admit that they are withdrawing it because of the adverse reactions. Now, a little more detail about Australia here. In Australia, the rate of AstraZeneca. Now they've got this syndrome here. This syndrome. The name's just gone. Thrombosis with thrombocytopenia syndrome. They've got that there, but they don't mention all the other side effects that we've just looked at from the UK data. So the Australian authorities are being genuine in one sense, but slightly not giving us the full picture in the other. But we've done that on this video by looking at the UK data. So aged over 62 per 100,000, aged under 62 to 3 per 100,000. But this, of course, is just this thrombocytopenia syndrome, not all of these other adverse reactions that we've just noted from the United Kingdom, of which there is a bar graph there. Some, unfortunately, with a particular adverse reaction that we don't like to see at all. So that is data from the United Kingdom, which contextualises, shall we say, the Australian data. So between the two countries, we're kind of getting somewhere near to the reality of the situation. The Australian authorities also note that thrombocytopenia syndrome can cause long-term disability and this unfortunate side effect as well. So blood clotting is the thrombosis. Thrombocytopenia is the low platelets. The platelets, of course, are the part of the blood that's responsible for helping blood to clot. Therefore, without the platelets, you get bleeding. So we get thrombosis, blood clots, and bleeding together. Blood clots can appear in different parts of the body, such as the brain or the abdomen. The Australian authorities are saying no risk factors were identified to predict people. So this side effect is idiosyncratic. Apart from the risk of age, younger age being greater risk, of course, we can't say, well, you've got this particular profile, you're more at risk. Not really. Young women, of course, but that's about it. Other than that, data difficult, or not difficult, we don't know it. But cases were reported, despite the predominance in younger women, across men and women. They do specify more in younger women. Almost all reported cases occurred after the first dose of the vaccine. Remember, most of the myocarditis and pericarditis, for example, after the mRNA vaccines occurred after the second dose. Not all, but most. Whereas with the Oxford AstraZeneca, most of the side effects were after the first dose. So we've seen these adverse events listed here from the UK data. We've seen the Australian government, all these are UK numbers. We've seen the Australian government saying that we're not using this vaccine now because we don't want any more of these side effects, thank you very much. So obviously the World Health Organization, being the world leading authority, you would expect it to be bang up to date. So let's look at what it's saying about it. This is the World Health Organization. I checked it about an hour and a half ago. Oh, right. So looks like the British authorities and the Australian authorities are both wrong. Well, get away. Because the World Health Organization has to be right, and that says the vaccine is safe and effective. Really, I mean, given the Australian reaction, given the American, well, we're going to come on to America in a minute because Johnson & Johnson's an adenovirus vector. Given this overwhelming evidence from Australia, given this overwhelming evidence from the United Kingdom, and then we have the World Health Organization on their current website saying this, the vaccine is safe and effective for all individuals above 18. Really? You say so, World Health Organization. I suppose all these numbers, the day's British data must be wrong, and I suppose this is a mistake as well. So why are we paying these people? Really? Really, really, really? But that's what the World Health Organization is saying. So this is saying that 19-year-old young women can have this vaccine and it's safe and effective. This is our World Health Organization. yellow card scheme in the UK. Again, AstraZeneca specific now. The data is coming out well and truly on this. Check it out for yourself. I'm not making this up. Total number of reported suspected adverse reactions, 250,000. Total number of suspected getting on for, well over, getting on for 0.9 million. Now, interestingly, I couldn't find how many doses of AstraZeneca were given in the UK or how many people were vaccinated. That information doesn't seem to be there anymore. Can't imagine it's more than 10 million people had the Oxford AstraZeneca vaccine. Give me a precise figure, please, if you have got one. If that's the total number of suspected adverse reactions, and even if we're given 100 million, it's getting on for 1%, isn't it? If we've given only 10 million people, then it's getting on for, so that would be 8.77%, wouldn't it? Incredibly high rate of suspected adverse reactions, and even serious reactions here, getting on for 200,000. Very high level. And then this number relates to another potential adverse reaction of the vaccine. Now, myocarditis and pericarditis, most commonly, of course, associated with the mRNA vaccines, but it has occurred after the Oxford AstraZeneca. Myocarditis, UK data, 241 reports. Pericarditis, 226 reports. So it is still happening, 9 reports of endocarditis. So less so than the mRNA vaccines. Now, the Oxford AstraZeneca, this is the Oxford's website here. They report that 2 billion doses of the vaccine have been given out as part of this successful campaign. Now, the reason for this is that hundreds of millions have been given out in India, produced by the Serum Institute, the Pune Serum Institute, which is basically the same. It's basically the same vaccine, just produced in India. So that's 2 billion doses. So if the rate of side effects is 1 in 10, that means that many people will have a side effect. If it's 1 in 100, it means that many people will have a side effect. If it's as low as 1 in 1,000, that means serious side effects could be 2 million. Purely because of the very large numbers of vaccine doses that have been given out. Now, how does this relate to the States? Well, the United States, now again, I couldn't find out how many Johnson & Johnson vaccines have been given out lately in the States. Not many, I don't think. But the CDC website, as today, says this: Johnson & Johnson vaccine is a viral vector vaccine and can be given in some situations. So it's still allowed in the United States. The numbers given in the States, here we have the overall numbers of vaccines given. And thankfully, we see that the adenovirus vector vaccine here is a relatively small proportion, but that still relates to 31.5 million people doses given out. And normally it was only 1 dose per person, so that's 31 million. So if 1 in 10 had side effects, that would be that. If 1 in 100 had side effects, that would be that. We're still talking about a lot of information here that we don't really have on these complications in the United States. Timeline-wise, just to finish now, Australia timeline-wise, so I left that hyperlink in there. Click on it for yourself if you want to see it. 8th of April 2021, it was flagged up. Australian government received advice and recommendations about AstraZeneca thrombosis with thrombocytopenia syndrome. April, May, June, they recommended alternative to AstraZeneca for the under 60s. Didn't ban the whole thing till 2023. A response that you might think is a little slow. And I think that just sums up the whole response to these vaccine adverse reactions, that the response has been a little slow. Let's just close with that rather nice picture. If you live in Oxford, do let me know. Have they put a blanket over this, or is it still there? But It really does look quite nice, but that DNA that represents there actually goes into the cell nucleus. It's transcribed into RNA. It's translated into the full spike protein, I think, in the ribosomes. And to mark the 10 millionth vaccine in the UK. There you go. Beautiful sculpture. Pity about the, what's the word? Rare adverse reactions to the adenovirus vector vaccines. And of course, the implications for all future adenovirus vector vaccines needs to be reassessed from scratch, I would have thought. But never mind, all the damehoods and knighthoods are given out already now, so yeah, there you go. You've got to make light of this in a sense because it's just so tragic, isn't it? It's such a serious situation for the lives of many, many, potentially millions. Yeah. Okay, you get the message. Thank you for watching.